Now let me bring you an unusual story about a woman who cannot speak by herself. Any sound that she alters is by the help of an instrument, and all is because she has throat cancer. That's the story of Mary Amankwa Fojo, who joins me in the studio to share her experience and what you can do to avoid falling into this situation. So, Mary, you're welcome to the pause. So you are just telling me that the voice you are altering is artificial voice.
Yes.
Why do you call it artificial?
I call it artificial voice because, unfortunately for me, I was diagnosed with throat cancer. Actually, this month, it's ended the cancer awareness.
Okay.
And because I'm a member of it and a victim of it, I decided to make a lot of noise about it. It's my common condition. I found myself having a throat cancer, and through that I have to use my vocal box. And the vocal box gives 3 things in my life.
Okay.
We talk through it, we breathe through it, and then we eat through it. So if you have problem with this, I'm going to like these 3 things. So I don't have a vocal box. So in replacement, I'm using artificial voice.
And for you, this is a permanent feature of your life.
Yes, please.
And this month, you are creating awareness about throat cancer.
Yes.
Tell me your story, how the diagnosis and eventually the surgery and then this artificial provision.
Well, I'm a midwife
Okay.
and a baker. I work in the Volta region, to be precise, St. Anthony's Catholic Hospital. I had this hoarseness of voice. And I don't know what it was. I thought it was stress. It was breakage of voice. Anytime I talk, you hear breakage
In the voice. Like you were stammering.
Yes. I didn't take it serious. So one time I got up and I saw swelling. I thought it was infection. All the time she had something called Jemnukutu.
Okay. Yes,
So
I know.
thought it
I know.
was Jemnukutu those
Yes.
days. And then I treated with antibiotics. But 2 weeks after treatment, I realized it was not going. So I had to go and report for medical intervention. When I went to report, I went to Kolibu Teaching Hospital. They have to take a biopsy, and unfortunately for me, came out of throat cancer, stage 4.
Stage 4.
Yeah, very unfortunate.
Very advanced then.
Very advanced. Very unfortunate, laryngeal cancer. So that's how I had it.
So this surgery was done in Ghana?
Yeah.
And this instrument put there?
Yeah, by Kolibu Teaching Hospital, ENT department, by Dr. Bedu and his team.
So for how long have you been with the artificial instrument that help you to vocalize your words?
Artificial is about almost a year now. But the surgery was done in 2021.
And I'm certain that awareness about this is very low. And people may be working with signs and symptoms of it.
It's unfortunate a lot of people are dying from it, but it's not known to people. That's why I'm advocating and raising awareness about it.
So in terms of the awareness creation, what exactly are you doing regarding on this one?
I'm educating people. Ghanaians, we take our life for granted. Certain things happen to us and we think it's normal. It may not be normal. So I was talking about some of the causes of this thing. We have HPV, human papilloma virus. It's a sexual transmitted disease.
And it can cause throat cancer.
I'm telling you.
How?
It's a serious virus that causes cervical cancer. This virus can cause throat cancer, anal cancer, and penile cancer. People don't know. There are a lot of them. But the cancerous one is the size 16 and 18. And then apart from that, people will take a lot of alcohol. Excessive one, intensive one.
Very hot one.
Hot one.
45% alcoholic content, I know that.
Yeah. People will think that one to happen of it. Smokers, tobacco, and others. They are also prone to get throat cancer. And then your genetic makeup can also let you get, or working in an area where there are gases and chemicals. A lot of burns where smokes, you are also prone of it. Some of the signs and symptoms are massive cough.
Excessive cough.
You cough continuously, retreat, goes and come. Sore throat. You get sore throat, you take vitamin C, it goes and it comes.
Come back.
It's a signal.
You need to have a check.
Yeah, and when you have pain in the ear, most of the time you feel there's a pain in the ear, please go and check. It might be dangerous.
The one about the sexually transmitted diseases that can also result in throat cancer, it affects both sexes, right? Male and female.
Yes. Yeah, it affects both.
But who is at more risk?
Both.
Both. Everybody
But
can.
the male are getting the more because they smoke more and then the alcohol intake is more than the females. But when it comes to the sexual transmitted disease, of this, we do things to keep our partners.
Of course.
We go extra mouth.
Exactly.
We put our mouth in places.
Where the mouth is not supposed to be. So when you put your mouth where your mouth is not supposed to be, the danger is that you may be contracting this.
Of
Some
course.
people call it head. I don't know what it means. Maybe we'll try and explain it further.
Yeah, so you have to be conscious of what you do with your mouth and the holes you enter into.
And so it is important that people take serious view of these. You mentioned that people are dying out of this and they don't even know that they are working with these things.
A lot of people have witnessed some I started chemotherapy and radiation with them and they couldn't make it.
They couldn't make it.
They couldn't, in fact, it's a drastic life change condition that if you don't take care, depression can even kill you.
Of course.
My nose is not working because after the surgery, they are going to disconnect the area. So I don't breathe through my nose.
Wow.
I breathe through the hole at my neck. And the same hole I have my artificial voice and see And then I have feeding problems. So as I'm sitting, I'm on tubes.
You're on tubes.
Yeah.
So if you want to eat anything,
Yeah, if I want to eat, sometimes I pass it through my mouth. But if I'm having challenge, I go to my tube.
wow, that would be a spectacle.
Yeah, it's
But it doesn't mean the end of the world.
at all.
So you've taken this very important assignment to educate people to understand how are you going about it, and you have other avenues that people can access information through you.
Yeah, for the meantime, I've opened a WhatsApp group for all the throat cancers at Kolebo Teaching Hospital. As soon as you are diagnosed, the doctor should give it to me so that I can inspire you with my book now.
Right.
And then after that, I have a social media handle. I'm live I'm active on TikTok.
Right.
And then my
What's the name of the handle?
artificial voice of the voiceless.
Okay.
I'm talking for the voiceless. Most of the throat cancer patients are voiceless. Not all of them can use the device I'm using because of their medical conditions. So if God has given me the privilege, why not?
Make more noise about it.
I'm a talkative already.
Of course, I can see that. All right, well, thank you so much for coming. In the days to come, because it's a whole month awareness creation, we'll bring you more so that we can talk more about throat cancer and what we should look out for. If you are experiencing anything that you are not so sure about it, they need to have a check early so that it does not develop to end stage where it becomes extremely difficult to survive out of it.
Thanks for helping me.
All right.
God bless you.
Thank you so much for coming to and folks. That's our show this afternoon here on Join Us. For more stories, log on to our website, myjoyonline.com. My name is Elton Brobe. We shall be with you tomorrow, same time. Until then, have a good Eid Mubarak.